I grew up in Queens, New York, grateful that my parents made the decision to emigrate to the United States, and grateful for growing up not in poverty, but not far away from it either, and recognizing how we all benefited from living in a community where the social infrastructure allowed us a public school education. I think I'm a living example of the value of mentoring. It allows individuals to maximize their potential. It's really a very important role that all of us can play. Looking back, I feel as though there were angel teachers who shared their skills or provided a moment of kindness that changed my life. Heroic teachers who have the capacity to bend an individual life curve trajectory upward. It allowed me to find the parts of my professional and intellectual life and put it together in ways that allowed me to fulfill my passion in the life sciences, but also complement that with my desire to address real-world problems in real time. Higher ed gave me that opportunity even as higher ed evolved to the place where we can now put a label on what I was looking for as an undergraduate, and that is to be in a place where I can be translational. Public health is everywhere and nowhere. When we have a crisis, we recognize the value and the importance of public health. But public health is critical for complementing the medical healthcare delivery sciences with providing an infrastructure that assures the management, the reduction, the mitigation of emergent infections or changing environments or even changing lifestyles. So, public health touches all walks of life, but has the potential to really mitigate and narrow the gap of health disparities. I think an interdisciplinary approach is vital, essential to the Chan School's mission, because the problems we face are so complex. And the complexity of the problems require us to take a comprehensive approach that ranges from the very basic discovery science all the way down to the dissemination and delivery of interventions that address health problems. These include working across a range from vaccine development all the way down to urban design, where one would be addressing the multiple sets of public health, adverse health conditions that drive morbidity and mortality in populations. It's really unjust that one's longevity should be determined by the place of their birth. The fact that we share a responsibility to share what we know to improve the lives of those who are in need, locally as well as globally, is one of the large drivers that keeps the Chan School's faculty, students, staff, alumni, and friends engaged in wanting to solve problems that will have real meaningful impact